Testing, testing, 1, 2, 3, testing. Testing, testing. I'm probably still not showing up, right? Okay.
You said it's a little weird.
Who said that? Okay.
Testing, 1, 2, 3, testing.
Testing, testing, 1, 2, 3. Testing, testing. Testing, testing. Way better, she said.
Hello, thank you everybody for joining us. We're just going to get started. To start, I'm going to introduce Leslie Cooper Johnson, the Chief Culture Officer for Community Coalition.
Good afternoon, everyone. Whoa, really? Good afternoon, everyone. Okay, you're alive. It's not AI folks out here. Okay, cool. So good afternoon. Welcome to the Community Health Profiles launch. My name's Leslie Johnson, and I'm a member of the executive team here at Community Coalition. We're so pleased to host this event in partnership with the County of Los Angeles Department of Public Health, with whom we've had a long and productive relationship. So as some of you may know, the full name of Community Coalition is Community Coalition for Substance Abuse Prevention and Treatment. And we were founded back in 1990 by current Los Angeles Mayor Karen Bass. At that time, Ms. Bass was working as a physician's assistant in the emergency room at the County USC Medical Center. She had witnessed firsthand the influx of drug overdoses and gunshot wounds coming into the ER as a result of the crime and violence of the crack cocaine epidemic that was ravaging South LA. She joined with other local activists and community residents to establish Community Coalition as a progressive, community-driven response to these and other related issues, including the explosion of the foster care roles as families were being broken up due to the criminalization of addiction. So when I started working here at Community Coalition back in 2007, I was assigned to our contract with DPH, the Department of Public Health's Alcohol and Drug Program Administration, ADPA. Does anybody remember that? ADPA? Yeah? Okay, we're dating ourselves by doing this, but so this is pre-SAPC, ADPA, right? So I was responsible for writing reports related to the progress of our work around environmental prevention. So basically that's understanding that one's environment with all that it entails can either be a protective factor or a risk factor. So at Community Coalition, we believe that education, access to well-paying jobs and careers, green space, access to healthy food, all of these things are protective factors that can protect against the misuse of substances. So if we can create communities where people's needs are met, where they have agency to pursue their hopes and dreams, where they feel safe, we will have communities where fewer and fewer people are turning to substances to cope. And that's the chief form of prevention for us here at Community Coalition. So we're all here today to learn about the new Community Health Profiles platform. It's featuring data for over 100 key indicators of health and wellness for 179 places in LA County, so really significant. And the Community Health Profiles is aimed at promoting community health and well-being through data that informs advocacy, policy change, and educational initiatives. So as a community organizing institution that works with everyday people, qualitative data in the form of stories and testimonies around lived experience is of the utmost importance to us here. When we can couple the qualitative data that we get from our members and residents with really strong quantitative data, like the briefs, the reports, and the dashboards that DPH creates, we can make really strong cases for policy change as well as for funding to support our work. So for instance, one of the first efforts that Community Coalition launched as a young organization was an extensive needs assessment to identify the core concerns in the community. So we were doing qualitative data collection, right? The needs assessment garnered more than 1,100 responses, and to the surprise of the organization's leaders, residents identified liquor stores as the main issue in addressing the drug epidemic. Folks were thinking that people were gonna say, you know, there's all these crack houses everywhere, this is what we need to focus on, but because we went out and talked to people, we found out, no, it's not crack houses. I mean, crack houses were a problem, but it was liquor stores that people were really concerned about. So this revelation served as the basis for the Coalition's first major campaign and became a foundational aspect of our core public safety strategy. So liquor stores were a longstanding problem in the area. By the early 1990s, South LA's overconcentration of liquor stores had swelled to more than 700. So the neighborhood had more outlets than some 13 other states. And mapping and sharing this quantitative data helped us convey the problem in a really visceral way. So more than 200 liquor stores were destroyed during the '92 civil unrest. And actually, I wanted to show this. I know it's super small, I'll pass it around. But this is some of the way that we mapped this quantitative data to make our case, right? So On the left, you see here the state of Rhode Island, just over 1,000 square miles, 280 liquor stores. The neighborhood, not a state, right? The neighborhood of South Central, 54 square miles, over 700 liquor outlets. So this quantitative data, in combination with the qualitative data from residents, really helped us make this case around this campaign. So 200 liquor stores were destroyed during the '92 civil unrest, and originally the city had planned to fast track the rebuilding of all these liquor stores, and that was against community's wishes. So what we did is we launched the Rebuild South Central Without Liquor Stores campaign. It was a multi-year campaign that mobilized tens of thousands of residents to testify at over 150 hearings, rallies, and actions to prevent the reopening of these liquor stores. So the campaign eventually resulted in the permanent closure of over 150 liquor stores and the conversion of 40 into other businesses, such as laundromats, markets that did not sell alcohol, and nonprofit organizations as well. And then subsequent studies documenting the impact of the liquor store closures revealed a 27% decrease in crime in the areas where the liquor stores had once operated. So in a short time, Community Coalition had found a direct, effective, and data-driven way to reduce crime in the community and improve public health and safety without increasing incarceration or policing. So that's just one way that data has helped inform our campaigns and efforts towards transforming our community for the better. And I'm sure that many of you can speak to the power of data as a tool for conveying our stories and making our demands that we have for our families and our communities. So it's such an important tool, data, right? So we look forward to the live demo and of the new platform and the discussion to follow. And so again, welcome to Community Coalition, and thank you all for being with us today. Thank you. So next up, I'd like to introduce, is that okay? All right. Dr. Anish Mahajan, who's the Chief Deputy Director of Public Health.
Good afternoon, everybody, and thank you, Leslie, for that wonderful story. What an extraordinary example of people power, community voices affecting change using both qualitative and quantitative data. Just a wonderful example of why we are here today. Thank you. It's really an honor for us at the Department of Public Health and for me to be here at the Community Coalition, which, as we just heard, is an example of an extraordinary power of community organizing and is a leader for racial justice in LA County. You know, this organization is truly a leader in showing how we make change in the community, and we at Public Health are very interested in doing it just in the way that was just described. Under the direction, Community Coalition's profound commitment to creating healthier communities in South LA through the power of grassroots organizing and centering Black and Brown voices is a source of inspiration to us in the department. Public Health is proud to have you as a partner in advancing health equity and justice. I also want to extend my gratitude to all of the Community Coalition staff here, the volunteers, activists, and organizers who work tirelessly day in and day out to create real change for their communities. You allow us to all be filled with hope for the future. I also want to take a moment and give a shout out to a number of our partners who are here in attendance. I'm just going to run the list here. If I leave anyone out, I'm going to ask you to speak up. So we have Unite a Nation, Alzheimer's Association, the Esperanza Community Housing Corporation, South Central Heals, NAMI Urban Los Angeles, Inclusive Action for the City, Resilient, Community Build, Labor Community Service, Life Steps, Bienestar, Healing Circles, Red Cross, Moving Mountains by Illumination, Black Women Rally for Action, and El Nido. Did I leave anyone out? Yes. Please, go ahead. Altamed, yes, you're next on my list. Let me do the rest of my list. I also want to thank representatives from Altamed, from USC, from the St. John's Community Health, from Providence, Wilmington Community Clinic, Northeast Valley Health Corporation, and the San Fernando Community Health Center. Now, have I left anyone out? Please. Thank you. Wonderful to see you here. Anyone else? Okay, well, this is all about partnerships. This is all about putting data in the hands of our partners and in the community so that we can affect the kind of change we heard about from Leslie. So today we are here to launch the latest iteration of our community health profiles, a powerful tool to allow residents to access a wide variety of data on both health outcomes and the conditions impacting health in our local communities. We also know how important granular local level data is to allow for targeted policy interventions and activism. It is also important to be able to tell the story of individual communities because a single data point, as we heard, for the whole county often doesn't reflect our diversity of the actual lived experiences of our residents. That's why we created the community health profiles to provide accessible, local level data for over 100 indicators known to impact community health and well-being for the 179 communities we have in LA County, including incorporated cities, unincorporated areas, and the City of Los Angeles neighborhoods. I really enjoyed the maps that Leslie showed. I lived in Rhode Island for 11 years, and Rhode Island is, as she showed, 1,000 square miles and has about 1 million people in it. LA County is, a little bit larger than Rhode Island, but in geography, but has 10 million people in it, and it is a place of enormous diversity, which further underscores for me how important it is to have local level data. So the data within the community health profiles highlights the fact that where you live has a huge impact on your access to healthy environments and health affirming resources. This is often due to long-standing patterns of disinvestment and discriminatory and racist policies and practices that have disproportionately impacted Black and brown communities. These inequities and the impact of place as a determinant of health mean that we need locally focused efforts to improve health that take into account the specific conditions and experiences of each community. The best locally focused efforts are locally driven efforts. Residents themselves and community-based organizations like you are closest to the issues and know what's best for our communities and your communities. I've seen one of the most critical roles as the Public Health Department supporting and empowering community-led efforts to improve health and well-being. The community health profiles are designed to do just that by giving local level data back to the community so that it can be used to inform and support the vital work that you all are doing. Data can be very powerful, but it can't capture everything you all are seeing in the community. As Leslie said, our hope is that this data can be combined with community voices to support efforts to create healthier environments and combat health inequities across Los Angeles County. I want to thank our entire public health team. Many of them are here and in the back, and many are not here, who are involved in the development of this community health profiles tool. They've been very dedicated to this effort, believe in the effort, and which is why they put in all of this work. I also want to appreciate the thousands of LA County residents who took part in surveys and other data collection projects that allowed us to compile this data to create the tool. It's important to remember that behind each data point is a person, a family, and a community. So we look forward to collaborating with Community Coalition and with all of you here and other partners not in the room on community-centered efforts. Our role is to help empower, provide the data, and help advocate with you all side by side to improve the well-being and health of our community. So thanks so much. I'd like to next invite Jeanette Robinson, if she is here. Oh, I'm sorry. Jeanette is not here. My apologies. We will next go to Rashmi Shetgiri, the Chief Science Officer for Public Health.
All right. So good afternoon again. That was great, so much better. Yes, you were prepared very well, Leslie. So I am Rashmi Shetgiri, as Dr. Mahajan mentioned. I'm the Chief Science Officer for the LA County Public Health Department, and I'm really grateful for this opportunity to be able to talk to you all about our 2024 Los Angeles County Community Health Profiles. So I'll start today by presenting about the background of the community health profiles, of the initiative. Then I'll give an idea of the types of data that are included in the health profiles, and then some examples of the ways that the data could be used to support action to improve health. So Leslie already gave a really beautiful example. I'll give a couple of other options as well. And then later on today, there'll be a live demonstration of the Health Profiles data platform and an opportunity for you all to try the platform. We have a couple of computers in the back where people can try out the platform later on. So for many years, most of the health reports that we produced had only included data at the county and the service planning area levels. And although this is really helpful and useful to get a broad picture of health in the county, it really isn't enough for local level action. We received a lot of feedback from communities that the data were needed at more granular levels to meet community needs, including for community members to understand the health status of their community and to be able to use local data to improve health outcomes in the community. So in 2018, we released the first iteration of the community health profiles. And the current effort that we're presenting today builds on the 2018 profiles with improvements based on community input. The initiative has a few different objectives. The first is to provide geographically disaggregated data to communities in a way that's easily accessible and that can be used to improve health outcomes and drive local change. Another objective is to identify geographic inequities in health outcomes and the underlying factors that lead to those inequities. So health inequities are due in substantial part to underlying social, economic, and structural inequities in access to the opportunities and the conditions that promote optimal health. And as you'll see, we've attempted to explicitly make the connections between health inequities and these underlying factors. So ideally, this data, we hope, will be used to drive community-led improvements in health, data-driven policy initiatives, like what Leslie had talked about, and ultimately will help reduce health inequities in LA County. So the 2018 profiles had data for 58 indicators for 86 places in the county and could be accessed as PDF reports and Excel data tables. But then following the release, our department conducted a dissemination and engagement effort to raise awareness among our community stakeholders about the initiative, to provide technical assistance on using the data, and to get feedback about how to improve the next iteration of the profiles. And this happened through community meetings, one-on-one meetings, virtual communications, as well as focus groups with community-based organizations, city and county government officials, and many other stakeholders. This is a really brief summary. We got a lot of feedback. Overall, the feedback was very positive. People really appreciated this data. But what I'm talking about here is really the feedback that we implemented in order to make the changes for this iteration of the profiles. So some of the main feedback was most often mentioned, there was a request to present the data in a more interactive way. And the recommendation was to use a map-based interface as the main data platform. We were also asked for additional geographies, including more neighborhoods in the city of LA and unincorporated areas of the county, and for more indicators covering additional topics. And finally, there were requests to develop accompanying video tutorials for how to navigate the data and the data platform, especially if it's a map-based platform that's a little bit more complex. People really wanted that at their fingertips to be able to understand how to navigate that. So we took this really, really helpful feedback that people gave us to develop the new version of the community health profiles. So the 2024 profiles include data for 179 places in the county, including incorporated cities, unincorporated communities, and City of LA neighborhoods with populations of 20,000 or higher, as well as the LA City Council districts, the 8 county service planning areas, and the 5 supervisorial districts. They also include data for LA County overall for each of the indicators. And we use data from multiple data sources, including local level data, such as our recently released Los Angeles County Health Survey, state data, and national data. And as recommended by community input, we used a map-based interactive data platform, And we expect this to be an iterative initiative. So we expect this to continue to evolve in response to community needs. So we're also looking for continued feedback on improvement. So we have over 100 indicators. They're a combination of traditional health outcomes such as diabetes, cancer, asthma, health behaviors such as smoking, broader determinants of health such as healthcare access, and then social, economic, and environmental determinants of health such as poverty, housing, and environmental conditions. The indicators are organized into 11 thematic or topic areas. And we've organized the data in a way to really intentionally try to broaden the perspective from simply looking at individual level interventions to the environmental, social, and economic influences on health behaviors and outcomes, and to really try to promote systems level change through advocacy and policy. This also, presenting the data in this way also allows communities to examine data in a way that can help identify multiple potential levels of intervention. So here are the topic areas: demographics, social determinants of health, physical activity and nutrition, tobacco use, housing and health, community safety, environmental justice, perinatal and infant health, behavioral health, HIV and other sexually transmitted infections, and healthcare access. And just as an example, here are some of the many indicators from the social determinants of health topic area. So again, we've aimed to intentionally connect health outcomes with the underlying factors that contribute to these outcomes. So in this section, we include the health outcomes of life expectancy and mortality, and also include indicators related to education, income and poverty, employment, social and emotional health, and civic engagement, all of which contribute substantially to health and well-being in our communities. And then our partners at Community Coalition had also mentioned that there may be many of you in the audience who work with children and youth. So these are just some of the indicators that we have that are focused on children and youth. I'm not going to read through all of these, but for those of you who work in the area, just wanted to make sure that you knew that these were in there. They're spread out across multiple topic areas. There are also many ways that the data can be used. So as Leslie had mentioned, that was one really great way to take the data all the way to using the data, the quantitative data with the qualitative data, and taking it all the way to action and policy, and really making community level change. That was beautifully demonstrated of the kinds of things that you can do with this data. I'm going to talk about a couple of other ways that it could potentially be used to meet some of those goals as well. So one of the ways is to identify geographic inequities. So when we look at the different indicators across communities, we see substantial geographic inequities. For example, in 8 communities, life expectancy is less than 75 years, whereas in 5 communities, it's greater than or equal to 85 years, which is more than a 10-year difference within the same county. When looking at chronic health conditions, which can impact life expectancy, such as obesity, in 11 communities, fewer than 15% of adults are obese, whereas in 26 communities, more than 40% of adults are obese, which is more than double. And then as I mentioned before, inequities in health are often due to inequities in the underlying structural conditions that can promote or worsen health. When we look at recreational space available to communities for health promoting physical activity, we see that 17 communities have more than 30 acres of recreational space per 1,000 residents, but 15 communities have less than a quarter of an acre of recreational space per 1,000 residents. And in 10 communities, less than 30% of the population lives near a supermarket or grocery store, whereas in 19 communities, more than 90% does. Educational opportunities beginning in early childhood also impact long-term health outcomes. We see that the percent of 3 to 4-year-old children enrolled in preschool also differs greatly. In 8 communities, more than 75% of these children are enrolled in preschool, whereas in 12 communities, less than half that number, or 35%, are enrolled in preschool. And as we all know, the cost of housing is high in LA County, and many households experience severe housing burden, which is defined as spending more than 50% of their income on housing. But even in this, we see inequities, where in 29 communities, more than 30% of households are severely housing burdened, whereas in 5 communities, fewer than 15% are severely housing burdened. Another example of how the data could be used is to look at multiple indicators within one community to identify areas for targeting policy and prevention strategies. So to do this, I can start by looking at a health outcome for a community of interest, which could be any community that I live in, that I work in, or that I'm interested in, that my organization works with, in which I'm interested in working to improve community conditions. So in this case, the data that I've shown is for Athens Westmont, but you can think of any community that you live in, work with, work in. So the main health outcome that we're looking at in this example is coronary heart disease, mortality, which is deaths from heart disease. And it's almost 150 deaths per 100,000 population, higher than the LA County rate of 101.6 deaths per 100,000 population. We can then move to looking at some of the chronic conditions that can lead to heart disease deaths. So in this case, almost a third of adults in this community have hypertension or high blood pressure, and 43.7% are obese, both of which can increase the risk of poor outcomes from heart disease. Access to high-quality healthcare is also important for identifying and managing diseases such as high blood pressure and obesity. Almost 1 out of 3 adults in this community have difficulty accessing care. Improving access to care could then be one potential area for intervention in this community that could impact health outcomes such as heart disease mortality. Access to healthy food is also important for preventing and managing obesity and high blood pressure, and for reducing risk of death from heart disease. Here we see that in this community, 44% of adults live in households that are food insecure, meaning that they're unable to reliably afford or access enough food. Members of this community also have worse access to fresh fruits and vegetables compared with LA County overall, and less than half of the population in this community lives in close proximity to a supermarket or grocery store. So here again, we see multiple potential areas for structural interventions to improve community access to healthy food, which could then contribute to improved health conditions and then subsequently to reductions in death from heart disease. So hopefully these data have given you an idea, just a flavor of the type of information we've included in the health profiles, and some examples of how it could be used, including for understanding the health of specific communities and the underlying determinants that contribute to health in those communities, for identifying areas of inequities across communities in indicators of health and its determinants, and for recognizing areas for prevention, intervention, and policies to drive community improvements in health. So this is the website for the data platform, and a little bit later we'll have a demonstration of the data platform so that you can see how you can look at the data yourself to use it in ways that it would be most helpful for your communities. But first, I wanted to bring up Akil Bell. Is Akil here? Right over there. Okay, great. So I want to bring up Akil Bell from Black Women for Wellness, who we're very fortunate to have join us today. Thank you so much. Oh, you can use either one, I think. I'm short, so I have to use this. You can use that. And then after we're done, I'll introduce the next speaker.
Okay, cool. Actually, you can use this mic. And now, this is for the live stream. Okay.
Greetings, everyone. All right. Let's see, I'm a game time stand-in. But a little bit about me. Again, my name is Akil Bell. I'm the Grants and Contracts Manager at Black Women for Wellness. So I can definitely speak to the need for and the value of this data, right? So when we start talking about the funding that we're going after as a reproductive justice focused organization, Black-led, women-led organization whose focus is really around public health, right? Our start is around reproductive justice, maternal health. How do we ensure that Black women are centered in the healthcare system, right? And then also how do we ensure that young students in the communities that we're serving are getting the healthcare that they need through sex ed, through reproductive justice education, through STD education and awareness, and also the healthy clinics that are within the schools, right? So, and then we look at um, environmental justice, right? And so a lot of our work has now developed into looking at environmental justice factors. And I want to back up a little bit. So I just want to give a little bit kind of why this is so valuable. And backing up, our mission is to support the health and well-being of Black women and girls. And we do that through education, advocacy, and empowerment. The education, kind of what we talked about. And so this data, again, will support that education piece. And then when we talk about the advocacy work that we're doing, we have a sister organization that we work with called Black Women for Wellness Action Project, which does a lot of the policy work, right? And so they'll go and take the information that we get here, take the information from community, and say, okay, legislator, let's make these changes. Let's make sure the resources are there. Let's make sure the laws are made to make this work, right? And then we come back, and then we look at the monitoring of that, right? And so now the policy has been made, the legislation has been passed, the governor signed it. Now we got to make sure budget is right. Now we got to make sure that things are being implemented that's in the policy, right? So, and so that's the advocacy piece. And then the empowerment piece for us around getting community members engaged in the work, right? So we're thinking about our members, we're thinking about our volunteers, we're thinking about our staff, right, of 50 people that are also community members in South LA, and who have an opportunity to be of service, but also are looking at how these resources affect them and their families as well. So, so I wanted to touch on that first, and so that's why this data is so valuable and so important. So I want to kind of congratulate LA County for getting this out, right, and doing the work to make it happen. So, let's give them a hand, please. And I'll drill down a little bit more on the funding. So this data will help us with the statewide funding, right? So when we go after funders that are looking at statewide how to support reproductive justice, environmental justice, sex education, organizations that are doing work around social determinants of health, this data will allow us to communicate with the folks that are doing stuff statewide, funding organizations that are statewide but don't know much about LA. And then the national funders, right? Funders that are looking to fund organizations all across the country that are not centered to LA or California. And so that's where this will be helpful in putting together grants. We've had to use outdated data, right? And try to figure out for ourselves internally how to collect current data from our community members, from the women we're serving as well. And then this will also allow us to educate our community members to become, to get in the movement, right, in social justice, to become vocal to address these issues, right, participating in county advocacy days or state advocacy days or LA City council meetings to be able to take this information and talk to folks with data in addition to lived experience. The other thing for us is something we're really tapping into, and we love Coco for this as well, is the idea of building power, right? Looking at the larger ecosystem of organizations throughout LA that are working together to move the work. And then going back to our MIH work, maternal infant health, we're connected to a group called the African American Infant Maternity Mortality Community Action Team, which is designed to address maternal health, right? That's countywide. And so this will support us as we participate in those conversations as a part of those community action teams to empower community members to be engaged. Also, environmental justice, our environmental justice work, this will support that as we look to get oil wells shut down, right? Because we know the communities where the oil wells are have the highest concentration of impact on health, right? And so we're talking about asthma, we're talking about tobacco use. We're talking about all the factors where these oil wells are, and how they're impacting. Also, we have our Sisters in Motion program, which offers a food distribution program, right? And so to address the data issues that we saw before this even came out, especially during the pandemic, we created a food distribution program, and this supports that as well. And then the diabetes prevention. We have a statewide diabetes prevention program where we train people on the impacts of diabetes, and then give them access to resources to help them design a healthcare process and a healthy lifestyle, right? Transformation is tied to that whole empowerment. The last thing I can say is the ongoing partnership with COCO, of course with the county and other nonprofit organizations, community-based organizations throughout LA. That's going to strengthen our efforts. This is going to strengthen our efforts and allow us to do more, to access more resources. And sometimes it's not always about the funding, but it's also about the relationships, also about the other resources that don't often get talked about but need to be shared, right? And then the last thing for us, we've always been, definitely since the pandemic, looking at how racism is a public health issue, right? And so this data also lends information and more credence to that as well. And so there's movements around to really look at how racism has played a part in the health outcomes within our communities. And so, so for us, this is very vital to our sustainability, very vital to the regeneration of our communities, and very vital to the continued building of ecosystems and collaborations amongst county, city, and community-based organizations to have a positive impact on public health and health outcomes. So thank you.
Thank you, Mr. Bell. So next, we're going to bring up Dr. Megha Shah, who's the director of our Office of Health Assessment and Epidemiology in the Department of Public Health. And this is really the team that has led the development of the health profiles and this platform, and really pulling all the data together. And we're just so excited for you all to see it and hopefully use it. So.
Oops, hold on, sorry. Apologies.
All right, good afternoon, everyone. Good afternoon. Love it. All right. Well, thank you all for being here today. It's really my pleasure to share this new tool that we've developed with all of you. So I'm going to be giving just a very brief demonstration of the website and the new data platform that we've developed for the Community Health Profiles Data Initiative. And really my goal with this is to just give you all kind of like a taste, an overview of what it looks and feels like, how you can use this tool to explore, visualize, and access data for communities across LA County. So right now, this is actually the homepage for the data initiative. So you can reach this homepage by typing in that URL, ph.lacounty.gov/community-health-profiles. You can also access, yeah, we tried to make it easy for folks. We also have a link to the data initiative from the Public Health Department's main homepage as well. So that's another way that you can get access to the data platform. But anyway, so this is basically how the homepage is set up, and so all right, and then as you scroll down, you'll see that we've actually made the information for the Community Health Profiles project available in three different formats. And so I'll go into a little bit more detail about each of those formats momentarily. But we have a map-based platform. We have a comparison tool, which is also map-based. And then we have reports that we've developed for each of the geographic areas that we've included in the data initiative. And then if you continue actually scrolling down on the home page, you'll see that, you know, as Dr. Shakegiri shared, we really see this as an initiative that we're doing in collaboration with our community partners. And so for us, making sure that we are making this information accessible and relevant to all the work that you all are doing is crucial to us. And so we wanted to make it really easy for you to get in touch with us for any reason at all, whether that be, you know, if you have specific questions, specific needs that you feel that aren't necessarily being met with what we have here. If you had feedback for us, if you want to share, you know, examples or stories with us of how you're using the data, really for any reason at all, we want you to feel free to reach out and contact our team. And so this link is here, and this is actually on every page of the website, so it should be easy to find this information no matter where you are exploring on the website. The other thing we have here is a link to stay updated. So this was one of the asks that we received from the 2018 effort was for us to be able to offer you know, those who are interested a way to subscribe to get updates when we release new features or new data on the website. So again, these two things, this get in touch and stay updated, they're there on every single page of the website. And so moving back to the top, we also have a navigation menu here that basically shows you how the website's organized. We have an About section, which goes into a little bit more background details about the data initiative for those who are curious. We have a Get Help section, a place where we're going to post updates. For those that really want to get more technical information about how we sourced the data for the initiative and actually constructed all of the indicators, we have a full methodology report. And then we also have a link here to download data for anybody that wishes to download the data for themselves and create their own sort of customized products with the information. So the only you know, page here that I will just point out briefly is our Get Help page. As Dr. Shakegiri mentioned, we really wanted to develop resources to make this platform user-friendly and to get it into the hands of as many people as possible with the support to really show people how to use the tools. And so here we have all of our tutorial videos. And then if you scroll down on the page, we also have a frequently asked questions section that we've developed. And so we really invite you all to take advantage, take a look. You know, again, we really are open to feedback. If there's anything that you feel should be on this in terms of providing more support for actually accessing and using the data, we really want to hear from you about that. Okay. So now actually going through the data tools themselves. So first up, we have our interactive map-based platform. So again, you can access this from the homepage of the site. And really, you have the option to launch the platform to view different geography types. And so at the bottom here, you have the option to select cities and unincorporated areas. You can look at supervisorial districts, service planning areas, and then, you know, if a lot of your work is in the city of Los Angeles, we have a customized platform that we've developed for the city of LA, which includes information for neighborhoods and council districts. So for the purposes of this demo, I'm going to actually go ahead and launch the cities and unincorporated area platform. So it'll launch and open up in a new tab. Give it just a minute for the map to load. Here we go. So this is what it's going to look like when you open it up. So just to orient you, the default view that's going to open up when you launch this is on the map itself. And it's going to show you basically information for the first indicator in the first theme that we have presented here. So to orient you, really on the left-hand side here, you know, the menu basically shows all of the themes, the 11 thematic areas we have organized the data under. And then for each theme, we have an About section a map, which is what you're viewing right now, and then a report. So I'm actually going to jump to the social determinants of health section and use that as an example for this demonstration. So if you click on the About section, that's going to pull up just some background information about this theme. And really what we're doing here is offering you some narrative information that describes why this theme matters, why this area is important to public health. And then in the second paragraph, we also include information about what our department is doing to address this area. Below that, we've actually listed out all the indicators that are included in this theme. So this is one of our larger sections, so there's quite a few of them here. And then for those that really kind of want to look at each indicator more closely, we have this more info option, which if you click on it, it'll bring up a pop-up which provides a description of the indicator, again, some additional information describing why it's important, why we care about it in terms of public health, information about the data source, and then also information about how you can download the data or visit the methodology report in case you want to get more technical information about how we created the information for this indicator. So then moving into the map. So as I described earlier, the way it works is that as you move through each of these thematic areas, the map is automatically going to default to the very first indicator listed in that section. So here, actually, what we're seeing on the screen is life expectancy at birth. Now, if you look at the navigation menu on the right-hand side, this is really where it provides the full list of indicators, and you essentially can only view one indicator at a time on the map. And so, if you want to move down this list and say, look at the second indicator in the list, which is all-cause mortality, you would just uncheck life expectancy, click all-cause mortality, and now it's going to bring up the information for all-cause mortality. To understand and interpret what the different colors mean, you just expand the legend, and here it basically shows you, the information that's being conveyed on the map. So essentially, areas in the county that have the darker color have higher all-cause mortality rates than areas in the county with the lighter color. So I'm going to actually just move back to life expectancy as I continue through this demo. So if you want to focus in on a particular city or unincorporated area, the way you would do that is using the navigation menu on the left-hand side here. And so this, if you click the little arrow, it's going to give you a drop-down menu, and then from this drop-down menu, you can select the community that you want to look at data for. So for this example, we'll pick Athens Westmont, and then what the map will do is zoom into Athens Westmont. If you click within the map, oops, this might be it. Yeah, here we go. A pop-up box will come up, and it's going to provide you the exact statistics for this particular area. The other way you can, locate where in the county you want to zoom to is there's a search function up here, and you can actually type in a specific address, and the map will zoom to that place. So you can X out, you can zoom out, and really you can kind of click through this list and look at any, number of cities and communities that you would like to. The other thing that to note about sort of this map functionality is say you work in a particular place in the county, but you want to know, okay, well what board of supervisor district does my geography actually belong to, or what service planning area am I in? You can go to this boundaries option here and actually add those boundaries onto the map. So I might have to zoom out to actually have them show. And hopefully they're visible to you all here, but you'll see then now we have the SPA boundaries turned on. So you can see, okay, here's Athens Westmont, which is the community I had originally selected, and it looks like it is in SPA 8. So I'll just turn that off. Okay. The other thing you can do with the map off the main platform is while you can't look at two indicators simultaneously on the map, there is a compare feature that is built into this platform that can allow you to basically sort of slide the view between two different indicators. So I'm going to just show you how to do that really quickly. So you're looking at life expectancy, and say you want to see how life expectancy maybe correlates with another indicator in this theme. Let's select median household income. So you go ahead and select those two, you hit compare, turn it on, and then basically you say, I want life expectancy checked because I want that to show up on the left-hand side. And then you scroll down and tell the tool, I want to look at median household income on the right-hand side. There we go. And now what it'll let you do is kind of slide back and forth between the two. So that's a way that you can kind of just visually take a look at the data at the same time. We actually developed a separate tool to also offer another way to sort of visually look at this information side by side, because we understand that some people might actually want to look at two maps rather than using this slider tool. So I'm going to go into that in just a second. But just want to point out the last feature that's accessible through this map-based platform is a report feature. And this we developed because we understand that there are some people who may not necessarily want to look at the map and may still want to be able to just access all of the narrative content and all of the information for their particular area of interest. And so that's what this report function really allows people to do. And so basically when you hit report, what it's going to do is at the top, it's going to highlight the data theme that you're currently in the map-based platform. But this navigation menu will let you jump between any of the 11 data themes. So you can easily kind of move from section to section. You also have the option, if you want to look at sort of the complete report for whatever geography you're interested in, to open up the full report in a separate window. And so that's what this is right here. Okay? And so once you have this opened up, you can scroll down, and basically instead of showing the data on a map, it pulls all the data for all the indicators in one place and presents them as graphs, as figures. And so then you can scroll down and have all of your information in one place. A couple of things here. If you click on the information icon, it'll pull up that same information that we have in the About section about each indicator, which provides some more details as well as the data sources. And then the other thing that we wanted to enable with this was a way for people to sort of download these figures directly and then pull them into presentations or other things that they were printing. So you can do that by clicking the 3 lines icon, and then it'll give you options to download it in various image files. Okay, so that's basically what the report looks like. And so that report can be accessed from the map-based platform, but you can also access it directly off the homepage. So again, for users who may not necessarily need that interactive map, but just want a quick way to pull the data for their city or their community in one place, you have the option to launch the report directly off the homepage here by launching the report, or you can just go ahead and just download the report if you just want to download it and print it off and take it with you. So that option is there as well. Okay, so now quickly just giving you a brief demo of this comparison tool. So as I mentioned, we recognize that for some folks, having that ability to actually look at the mapped data side by side may be more helpful than using that slider tool on the application. And so that's why this tool was developed. So essentially when you launch the tool, it's going to load, it's going to bring up 2 side-by-side maps. The default view again is to LA County, and the default geography is cities and unincorporated areas. So if you want to change the geography you're looking at, you can do that up here. We have a zoom to function. Oh, I'm sorry, here, other geographies, so you can change. So if you don't want to look at cities and unincorporated areas and you say you want to look at LA city neighborhoods, you can do that by changing the filter up here at the top. So similarly, you can use the Zoom to look at a specific place in the county. So again, just continuing with Athens Westmont as our example, it'll take you right there. And then really what you have the opportunity to do with this is filter the information you're seeing on the left and the right-hand side of the screen. So right now, this is defaulted to show you information for social determinants of health, life expectancy indicator on both sides. but you can change what you're looking at. So you can do that by either scrolling down, or you can search for the indicator using this bar. So say you wanted to look at information about obesity. You click that here, and then now the map will bring up information on obesity. So you can actually look at obesity information side by side with life expectancy information. And similarly, we have a legend which basically tells you what the colors mean. So in this case, you know, the more dark the color, the higher the value. And so what we're seeing is in Athens Westmont, we have you know, a relatively higher rate of obesity with also a relatively lower life expectancy. Similar to the map tool, you can click on the map and it will bring up sort of the exact statistic for the area that you're looking at. You can also zoom out. So if you want to say, zoom out and look at some of the neighborhoods around and how they compare, the map lets you do that. So yeah, this is basically the functionality of the comparison tool. So I'll stop here actually. That's sort of the main things that I just wanted to show you all with the demo. As Dr. Shekgiri mentioned, we actually have some laptops set up in the back. So our staff is here to help those of you who are interested in sort of getting hands-on experience yourself, exploring the tool with yourself. But yeah, I'll give it back to you, Rashmi.
Hopefully that was helpful. It might have been a little overwhelming, which is why we have the video tutorials. So you're not going to have a test and be expected to remember all these things. The videos go through each of these different features, so you can go back and look at those. So we can open up now for some time for questions, and then after that, then those of you who want to play with the computers in the back and look at the tool, I think we can move on to that. But first we'll stop and see and if anyone has any questions or comments or anything that you want to share. There's a mic back there, so if you can just raise your hand.
Hi, good afternoon, everyone. Is there a way to download an aggregate community report? Let's say I want to look at not only Huntington Park, but Southeast LA as a region with its own kind of identity. Is there a way to do that?
Yeah, that's a great question. So that is not a feature that we have currently enabled, but that's a place where you can get in touch and you know, see if we can maybe create something custom for you. And I think if that is a feature that a lot of folks do find useful and want in the future, I mean, I think we could definitely look into sort of developing that. But yeah.
I just have a question around the languages that this might be available to community members in. Is English currently the only language?
Yeah, English is currently the only language, but you know, we can definitely look into developing it in other languages if there's a need. So I think that this is exactly the sort of feedback we welcome.
Yeah, I mean,
I also want to say this is amazing. So thank you. I wanted to preface with that and then I jumped into it.
no, because you were thinking about what do you want next? That's great. So we did have in the last iteration of the health profiles, we did have the actual like reports also done in Spanish. So that's something that we can talk about as well.
Hi everyone, Carlos Leon, organizer here at Community Coalition. Thank you very much. I remember years ago trying to figure out where to get the data, just like our other colleague from Black Women for Wellness share. So this is very helpful. I would assert that languages is not only a possibility, but as we're engaging members constantly, it's been a huge factor in terms of access. I would also offer maybe if there's an idea beyond organizations and people that have access to this space information is thinking of revamping a strategy maybe for community. At the end of the day, the faster and more people that have access is the more power they can have to be able to change their own conditions, but also like collectively do it and empower them. I think 211, 311 went through that process as an app and as a application. A lot of our communities currently don't have access to internet. They're choosing between rent, food, and accessing all these items. So you're thinking of a community strategy if possible. I had a last thing, but Yeah, I think what comes to mind right now is the current debate between criminalizing poverty and unhealthy communities, and we're looking at the social determinants of health in a public lens. So really thank you for that, because I think there's a big debate not only in our community, but in the city, and budgets coming up, and all these things are coming up where community might not have access to the right information to look at the racialized profiles and policies for decades that have happened, that have created the current issues that we're facing. And there is a group that are thinking of criminalizing policies to deal with the issue versus looking at a public health lens and social determinants of health. So thank you for bringing that up, but I am trying to figure out how do we do this in a bigger sense so that all the people that are impacted the most have access to it beyond us. Thank you.
Thank you for that. I think that's really important. We want as many people to be able to access this as possible, because, you know, if people don't have the information, they can't use the information, they can't make the changes. This is sort of a first step. As we said, we're going to continue to try to iterate on this, and we're going to look for partnership from you all. One of the things is, you know, there are many organizations here right now, and if you all can take this out to the communities that you work with and the other organizations that you work with, that spreads the word even more. That spreads that access even more. So I think that would be, so we're so excited that you're all here. The other piece of it that I think, you know, we did think very intentionally about was to make sure that, that we have the narrative in there that really talks about, this is not about individual decisions. People's health is not just about individual decisions, and that's the narrative that's been happening for a long time. It's really about the structures and the systems that we've put in place and that we can change, which can then make the choices and decisions and opportunities easier for people to then have the health and well-being that they all deserve to have. So that was very intentional. I'm glad that you're recognizing it. I'm glad that that's going to be useful in the work that you're doing as well.
Hello. I'm wondering, in 2018, you did roll out those stakeholder feedback meetings, which I loved. I was in a couple of those. Will you be rolling those out this time around? And then also connected to that, you also sent like teams to provide presentations like at our coalition in Boyle Heights. Y'all came and you showed us how to do it. Are you also going to be doing that for this time, where there'll be technical assistance for CBOs and agencies?
So there's a different part of our department, that's our regional health offices, which were the folks that led some of those. So each service planning area has a regional health office, and so we've already actually talked with them, and they've seen all this, and we've kind of taught them. So they will be, you know, talking about this at different coalition meetings, and then, you know, we'll figure out how to coordinate with them. And then the other thing is also, you know, last time we did the engagement sessions, but one of the things we realized with that is when you do it in that way, there's only certain people that, you know, you don't access as many people as we would really like to. So that's why we put the sections that we have on here about the Get Help. We put that on there intentionally because we want everybody to be able to reach us. As opposed to last time, even though it was pretty extensive and we talked to a lot of people, it was still only the people who knew that we were looking for the feedback, not just any person who was touching the site. So that's where we're looking to start. But then we're also there will be, you know, those more regional kind of presentations and things that will happen.
Hi, I'm Alejandra from USC Norris Cancer Center. And I'm just wondering if for the social demographic portion, are we being inclusive of indigenous populations? Just because that's a population that often goes missed and we don't have a lot of data for their health outcomes.
That's a really good point. And it's, you know, so in this particular iteration of the profiles, we actually haven't, the way that we presented the data is not disaggregated by race and ethnicity. For multiple reasons. You know, one of the reasons is the numbers get smaller and smaller, and sometimes there's confidentiality issues. But then there's also this is not the only type of data that we release in the health department. So we have other reports, other data platforms, mortality, our health survey, all of these other kinds of things that have data disaggregated by race and ethnicity. And so some of the things, the question you're talking about is exactly the things that we're talking about is we have, you know, we've had conversations with groups that, not just about the American Indian and Alaska Native community, but the Native Hawaiian Pacific Pacific Islander community, some of our smaller communities that we haven't traditionally had as inclusive data as would be helpful for those communities to really be able to advocate and make the kinds of changes that need to happen. So that is an ongoing process. It is not there in this iteration, but it's something that we're working towards, not just for this, but for all of the data work that we're doing in the department. And I'm glad you brought it up.
Thank you for the presentation. My name is Erica Leslie. I'm from Community Build. I was wondering what type of demographics are included? Is race, what race and cultures are included in this iteration?
Yeah, so for demographics, we've included race and ethnicity, but focusing on just the major categories historically as a department that we've been able to report out on. And part of this, again, was a factor of the data sources, frankly, that we had available to us, right? Because in order to source the data down to these small geographic areas, we had to work with what the U.S. Census Bureau, for example, currently has available, which isn't very granular. So I think that's one of the challenges. So as Dr. Shakiri said, we are looking, especially toward in the future, other ways that we can sort of make that data more inclusive. Other than that, we have information about the total population. So just, population count. The population by age group. So we've separated that out into children, 17 and younger, and then older adults, 65 and older, and then the adult population, 18 to 64. So that's currently what we have on the platform. We have percentage of limited English proficient population as well. We are looking to add threshold languages in the future. We're currently working with the census to see if they'll release that data to us, so we can produce threshold language information for the communities that we've profiled. We have adults with disability, children with special health care needs, and I think those are the main ones that we have in the demographic section right now.
Thank you.
Sorry, there's one more thing I wanted to add for a couple of the questions that came up. One of the things is that this is sort of a launch of this platform that we're hoping to be a main platform that links to all sorts of different parts of our data, but not just our data. One of the things we really want to do is to be able to work with you all that if there's data that you're collecting in your communities, that, to find ways to add that potentially to this so that it actually makes some of that information more robust for your communities. So if there are thoughts that you have on that or ideas you have about that, please get in touch with us. It's not the kind of thing we've done before in the health profiles, but it's something that we feel like is important and want to try to do going forward. So if any of you have those ideas, then it'd be great to reach out to us.
We had a question sent in from Jackie Fortier from LAist asking if Pasadena and Long Beach data will be added since they have their own public health departments.
So we have not included Pasadena and Long Beach data specifically because they have their own public health departments. They're their own local jurisdictions. So they're the authorities for their jurisdictions. But we have linked to their data website so that people can, go there and kind of look at their information as well.
Just to add to that, though, for the larger geographic areas that Long Beach and Pasadena sit in, their data has been taken into account when producing summary statistics. So, for example, for any data that we show on SPA3, Pasadena data is a part of that SPA3 indicator information that we're sharing out. Same with SPA8 for Long Beach. But we just don't have specific profiles for those cities for the reasons that Dr. Shakiri shared.
Any other questions?
Hi, I'm Lauren Espy from MLK Community Healthcare. Thank you so much for this. I'm so happy to see this updated information. How often are you planning on updating?
Sure. Yeah, so we are going to make an effort to update this continuously. So we draw data from a lot of different sources. Some of those sources get updated annually. So for those indicators, we're going to make an effort to release new information annually. Other sources, only update every few years. And so we'll sort of have to do it based on when information becomes available. But we decided to do it this way because in that way, people who are using this information know that it's the most up-to-date information that's available for whatever
Sean, Red Cross. Hopefully it's loud enough. Hi, Sean, Red Cross. I just want to echo, this is incredible. Thank you for all the work that went into this. This feels like a ton of data, but is there any plan in the future to draw any conclusions about this data, about the most acute issues within communities, or is that more on CBOs, NGOs, to kind of use this data to inform the work that we're doing?
So the intention for us is to really provide the data to the communities that know what's going on in their communities, because we're trying to be careful about not trying to make a story about the different communities when we're not from those communities. So we're trying to put the data out so that those of you who are living and working in these communities can really take the data and say, this is what the data means in my community, and this is why it looks the way it does, rather than us creating those stories for the communities. So that's the direction that we decided to go.
Dr. Shakir, if you want to close this out.
Well, I just wanted to say thank you all. Well, I actually wanted to also, many of you have thanked us who are standing up here for this data, but I wanted our team that, most of who are back there, who really worked on this a lot for many, many months, to just stand up so that you can know that they, the folks who had worked on it. Thank you. And I want to thank you all. This is, it's just been, like I said, really exciting for us to be able to release this data after many years, 5 years, right? And it's wonderful to have you all here and see your response to it and your excitement about it and your eagerness for using it, and also all of your wonderful feedback about already thinking about the ways that we can make it better and the ways that we can partner. So just really looking forward to everyone using the data, to reaching out to us, to partnering with you all to use this to really make a difference in the county. So thank you all very much. Sorry, I also wanted to thank Community Coalition and all of the folks here